Good evening, everyone. Thank you for joining us. This is Nurse Janet Tom, aka the Fertility Nurse, and I'm so delighted to have you. It's been a while. Yeah. Thank you, the Fertility Health Hub, for staying put till now, 2026. It's really a promising year for us with a lot of goodies that life has in store and that God has in store for us. So I want to say a big shout out to my team of admins for their support and encouragement, and to you for being here. You could have been anywhere else, but you choose to be here. And I want to promise that you're not going to just waste your time, right? You're going to get value for your time. So we are moving straight to the business for the night. IVF, what you need to know. What you need to know. So I'm going to be talking about the basic things you need to know about IVF. So many persons have heard of it. Some persons do not even know what it means. So IVF simply means in vitro fertilization. In vitro fertilization, that's in glass. Vitro is another name for glass. So the fertilization, instead of being done in the womb, it is being done in glass in the lab, and then the resulting embryo is transferred to the woman's womb for a pregnancy to occur after implantation. So I'm going to be going step by step, and then just to let you know that IVF, it's more of like a miracle because it's actually a miracle. It brings the miracle of conception into the lab, right? So what could have been done naturally is being done with technology to assist couples who cannot conceive naturally. So what are the indications for IVF treatment? When there is a problem with the sperm, when there is a problem with the fallopian tubes, when the fallopian tubes are blocked, right, which um, obstructs the sperm from getting to meet the egg. And then when there is a problem with the woman's womb, the uterus, some persons have some additions in their womb, and in such cases where they cannot carry a baby, their eggs can be gotten and their partner's sperm and fertilized, and another woman might have to carry the baby for them. But in cases where there is an obstruction in the fallopian tubes, the IVF can actually help bypass that, the sperm having to travel all the way to the fallopian tubes, because fertilization occurs in the fallopian tube before the embryo comes back to the uterus. The sperm will have to travel through the vagina, through the uterus, and down to the fallopian tubes to meet the egg. So when the fallopian tubes are blocked, fertilization cannot occur. So that's where there's need for assistance, where the fertilization is done outside the body, and then the resulting embryo is transferred back to the woman's womb. So about 10 million babies have been born since the start of IVF. Since about 1978, about 10 million babies have been born, and then it's safe. It's a safe procedure, although the chances are 50-50. So these are the um, kind of information that will be relayed to you. So the first step for the process of IVF, you would have to see your OBGYN, that's your obstetrician gynecologist, and you'd have to do a consultation to know whether you will benefit from IVF. You will be told the risk when you go for the initial consultation with your OBGYN, your fertility specialist. So after all that have been done, after the consultation, you will be told to run some tests. And this consultation is done for both partners. You go with your partner, you have a consultation with your partner, with the doctor, and then you have a session where it will be just you and the doctor, and it will be just your partner and the doctor, right? Then afterwards, you'll be asked to do some tests like the fertility test, like the AMH, to test your ovarian reserve as a woman, your semen analysis to test your semen quality as a man, and then there will be blood tests for infection screening and all of that, genetic tests. There will be a list of tests for you to do. So this is what you should know. And then for the woman, there will be a baseline scan to know the state of your ovaries. And this scan is usually done on the second day of your menstrual cycle. That is from the day you start menstruating, the second day of your menstrual cycle. It is done transvaginally. It is not the normal abdominopelvic scan where the probe is on your tummy. This particular probe will be inserted your into your vagina, and then it is usually done on the second day of your menses, right? Because at that time your cervix is partially open, and then your eggs are starting a whole new cycle because this particular cycle is coming to a wrap. Okay, so that's said and done. So from the scans, your ovaries will be seen, and then the doctor or the fertility specialist will know what dosage of ovarian stimulation you will need. Remember, I said before, the egg is taken out from the woman's body and the sperm is taken out from the man's body, and it is fertilized in the lab. So to have higher chance of success, it is usually recommended to recruit a lot of eggs, and a lot of sperm, so that if this one doesn't work, the other one works, because the whole process is a whole lot. So you don't have to take small and then come back and say, let's do again. No, we normally recruit a lot of eggs. So the woman will be placed on injectable hormones depending on her peculiarity. So the prescription is dependent on individual peculiarity. Just so you're not using another person's prescription. So the doctor will know how much of the injectable hormone you need, and the injection lasts for about 10 to 14 days. Some persons usually come to the hospital to take these injections, and some take the injections by themselves. They are being taught how to take the injections by themselves at home, and it is usually somewhere around your abdomen, just adjacent to your navel, just few steps away from your navel. So, and it is usually subcutaneous with a very tiny needle. Okay, so that is that for the ovarian stimulation. And then the man's sperm. Okay, let me be done with the woman. So after the ovarian stimulation, the process will be monitored with scans. You'll be going for scans from time to time, and then your ovaries will be monitored to see how they are growing. It's usually a very beautiful thing to see how the follicles are, growing bigger and bigger on scan. So by the time you're around your time of ovulation, and by the time you've completed your injectable hormones, you'll be given a trigger shot. Usually it is HCG that is used. So you'll be given a trigger shot, and that trigger shot you be given in the hospital. And then 36 hours after that trigger shot, you have your egg collection. And the process of the egg collection, it's done under mild anesthesia, so you won't feel pain, right? It's done in the theater. There will be an ultrasound guided probe. Then there will be a very small needle attached to the probe and inserted in through your vagina to your down to your ovaries. And this process is done guided. It is visually guided. So whatever is happening in your womb, the gynecologist is seeing, or the person doing the scan is seeing it on the screen, so that he or she knows exactly where to puncture, because there are risk of injury. So the person actually has to know, I am puncturing the follicle in the ovary. So when the follicle is punctured, it is aspirated out, and then the egg is what is actually inside the fluid. It's like a fluid. It comes out and it's being given to the embryologist. So the embryologist collects the eggs in fluid-like form, and then examines and will tell the gynecologist, this is the number of eggs we've had from this particular client. So when that is done, the sperm is usually gotten that same day, because the egg cannot survive more than 24 hours, 24 hours max. So some people say 24 to 48 hours, but to be on a safe side, 24 hours is the max. So the sperm has to be on ground that day. The sperm can either be produced in the hospital, or if the person's residence is not so far, the person can produce it at home and then brings it to the facility. So when the sperm is brought, it will be washed, and then it will be selected for the fertilization to occur. There are two types. It can either be mixed with the eggs, or it can be fertilized directly. That's the embryologist will have to choose the most quality sperm and directly inject it to the egg, like one sperm to one egg, one sperm to one egg. So, and then it is placed in a culture in the lab and allowed for about some days for fertilization to occur. It will be placed in an incubator and then monitored. The process will be monitored. So about within a week, sometimes 3 to 5 days, the fertilization will occur. And by then the embryo has been formed to a level known as blastocyst. So the sperm and the egg coming together forms a zygote. And then after this stage, it divides, the cells divide, and it forms a blastocyst. That's an embryo with numerous cells, about hundreds of cells. So, are you following me at all? So, right, we've talked about the ovarian stimulation, the egg collection, and then the fertilization process and all of that. Then after this is the embryo transfer. The woman will be given a date to come in for her embryo transfer. And it's usually a very emotional thing, because they come in with quite some expectations, and they're like, "Ah, how is it going to be?" So before the transfer, you'll be told, this is the product of a fertilization. You have so and so number of embryos. Sometimes you can be advised to preserve the embryos, and it's often advisable. You can decide to preserve the embryos. Maybe if you have like 5 embryos, you can say, okay, I want to preserve 2, or I want to preserve 3, just in case this cycle doesn't work. Like I said, it's 50-50. So different facilities have a maximum number of embryos that they transfer. Some transfer 2 and some transfer 3, depending on your medical history, the state of your womb, and everything. The doctor will know how many embryos are best for you to transfer, and also depending on your request. Some people just want 1, some people just want 2, but it's usually 2 basically. So that is it. After the transfer, you'll be advised. This is the part I really love doing, because some persons, after the transfer, they just feel, okay, I've done it. But if you're not very careful, this is a precious pregnancy. After all pregnancies are precious, right? I'm not invalidating natural pregnancy, but I'm just saying, because this type of pregnancy is not a natural one, it is assisted. So there are extra precautions you would have to take, right? There are extra precautions you have to take as a mother and as an intending father. So the woman that has the embryo transfer done, hey, there are many things she won't be doing. If you've just had an embryo transfer, you won't lift heavy things. You won't sew if you are someone that uses a sewing machine a lot. You won't sew because it puts pressure on your pelvis. You won't. We even advise them not to sweep, not to bend down and sweep. We advise them not to cook. We advise them not to pound. That initial stage, you advise them not to pound because you're pounding maybe pepper or afang if you're from a tribe. You're pounding and it's exerting a kind of pressure on the pelvis. So you won't eat acidic fruits, you won't take alcohol, you won't smoke. It is advised that your partner provides a safe emotional environment for you. Expo. I want to give you an expo. If you have family members that can be very demanding, that can be very troublesome, you can't totally avoid them, but for the sake of your investment, because that's a lot of money, you could just get away for a while. And it is often advisable, those a particular client we counsel to just calm down, and if it's possible, she'll just stay away for a while, of course, with her spouse, and then because the initial cycle she had, it failed, and then her family members were blaming her that she should have waited, she shouldn't have gone to do the IVF, she should have waited, and all of that, and all of that, and all of that. She actually disclosed uh, the IVF process to them, and then they were not so happy about it. So emotions has emotions have a way of helping. It has a way of helping you, you know, um, cope with the whole process. IVF is not a walk in the park. It is not just, it is, like I said, IVF is not a walk in the park. It is not anyhow, anyhow. So you have to take precautions on what you are advised to do. So I've mentioned a list of things. There are some very, very hot, spicy foods you won't be eating. There is this spice called tetra plura. In my dialect, it is called uyayak, and it's often used for mothers that have given birth to help. They said it has a way of expelling the blood, right? So because of that contracting property, it is not advised to be used. So if you're going to take pepper soup, just ensure you prepare it by yourself because there's some spices that have a way of contracting. Some herbs and spices that can contract the uterus, and we don't want any contractions, any premature contractions. Okay, so pregnancy test is done. If you have any questions, please, you can still ask. Maybe I might have missed something or what you need to be cleared on a particular area. You can still ask there, down there in the group. All right, so pregnancy test is done 14 days after embryo transfer. Hmm. It is really an emotional time because people come in with expectations. I've invested so much. I've I've gone through a lot. So God, this has to work. Oh. This has to work. This has to work. But then, like we said, it's a 50-50. It lies in the hands of, will I say faith, or will I say it lies in the hands of God? However it is. Yeah, of course, God is a factor. So all through your process, you would have to invite him. You would have to involve him because he makes everything beautiful. And then after the pregnancy test is done, some persons even do their pregnancy test at home before coming to the fertility. And if the pregnancy is positive, then the woman will continue on some hormonal medications that she has already been taking before. She will continue on those hormonal medications because, like like we said, it's not a natural process. So your body needs some supplements of the hormones that support pregnancy, like progesterone, um, we give it in form of cyclogest pessary. So our other pessaries, that's just a a brand name. So it's progesterone. Some can be in form of insertions, injections. So these hormonal medications will support the pregnancy till about a certain time where you can go on with the pregnancy by yourself. And for women that have incompetent cervix, right, it is usually advised for them to have a cyclish. Even sometimes without incompetent cervix, people still advise for a cyclish. That's the doctors, sorry, not people. The doctor will still advise for a cyclish to be done. A cyclish is a procedure whereby your cervix is tied with a string in the lab so that the pregnancy is preserved. It prevents miscarriage and all of that. So by the time you're close to labor, the string is removed and then you can have your pregnancy and you can have your child or children, as the case may be. All right, so we have the whole process and everything. Okay, just to add, there's some supplement that may be prescribed for you, and one of the most important is folic acid. Folic acid is a must. In fact, it is advisable to take fertility supplements 3 months before your conception and all of that, before the IVF process. 3 months before the IVF process starts. And folic acid already, if you are up to 18 years old, you're listening to me. If you're up to 18 years old, whether you intend to get pregnant or you do not intend to get pregnant, folic acid is necessary and beneficial for your health as a woman. Even men do take folic acid. Studies have shown that it improves sperm quality. Clock it. So, where was I? Where was I? So that is it. So you need folic acid from your reproductive age. And then another very good fertility supplement usually recommended is the DHA. And then we have the CoQ10, that's the coenzyme Q10 supplement. And then there is vitamin D3. Yeah, it's very beneficial for the female ovum health. It is beneficial for your eggs, and as a man, you can take folic acid too. Like I said before, you can take ashwagandha. It comes in a capsule form. You can take fenugreek. It comes in a capsule form, and then the enzyme CoQ10 is also very, 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 very important for your sperm health. Very important for your sperm health. Some companies produce these supplements here and there, combining different supplements in one capsule so that you just have to take one a day. So you speak with your fertility specialist for the best supplements for you and your partner. So it's good to take the supplement alongside your partner. As you're taking it, your partner is also taking it so that it will improve your quality of sperm and egg. Now, another thing I would like to say is that for the men, before the semen collection, you're advised to abstain from intercourse 3 days before. Why? Because abstaining from intercourse 3 days before is we normally call it last day of ejaculation. Last ejaculation. So you abstain 3 days before. If you're getting your semen on a Friday, you can abstain on a Tuesday, right? You can abstain on a Tuesday from intercourse because that space of time allows for the sperms to regenerate and be more healthy, right? And if you've had issues with sperm, low sperm count, and all of that, you could be placed on some medications, uh, some supplements, and some other medications to improve the quality of the sperm. And then, oftentimes, those that have low sperm count, the the sperms are usually selected in the lab. So the best moving and quality sperms are usually selected and injected directly into the egg to have higher chance of a quality embryo for transfer. Okay, so before we round up, what happens? I just want us to know that because this is a 50-50, um, is a 50-50 procedure, we won't rule out the fact that some persons actually come and then they test negative. Now, what happens if the IVF process goes negative. Moment of silence. You've just lost something precious. And it's a two-way thing. It affects the woman and it also affects the man. So IVF, trying to conceive couples who go through IVF, they need that support from family, from friends, from health professionals. You don't just treat it like anyhow, because sometimes these persons have been sometimes these persons have been without children 5 years, 10 years, 15 years, 20 years. So coming all through this and having to test negative is not sweet. So you need all the support. You need a very healthy circle of friends that understand your journey. And then there are support groups, there are fertility support groups online and real time you could join where people share their stories, and these stories could go a long way of encouraging, because some persons try the first cycle, the second cycle. Some persons try the first cycle and they get twins, they get one, they get triplets. Some try first, second, they get at the second trial, some get at the third trial. But it is worth it. It is worth every try, it is worth every needle, because you never can tell which one. And it is also good that you have your hopes high. Yeah, you have a positive mindset towards this whole thing. And then if it happens that it doesn't work, you would have to check back with your fertility specialist, your OBGYN, to review your treatment and know what actually might have gone wrong. Did we miss anything? On your own part, you would have to check. Remember the woman I talked about earlier that had a lot of backlash from her family? That particular cycle failed. But on the second trial, where she had to get away from her very funny family members, and she spent quite some weeks in a faraway place, that pregnancy stayed. And to God's glory, she has her baby today. So any environment that might not have supported your journey or supported the process, the growth and everything, you could consider staying away for a while. And then you need to spend time to grieve. You just lost something precious. You just lost something precious. You need to spend time. Don't just say, I want to try again immediately. It is ideal to allow a full cycle to pass. That it's about 6 weeks. It's ideal to allow about a full cycle to pass, so that by then, for women that are menstruating, by then you've had your menses and every residue and everything, every residue of the conception must have been flushed out. Do you get? So maybe you're listening and you've tried IVF before, or maybe you've not tried IVF before, or maybe you know someone that has tried IVF before, or you intend to do. I want to believe that of all the things that have been said here, you could pick one or two things that would help you or help someone you know on their journey. And I want to conclude on this note that conception is conception, whether it is through a natural means or through assistance by technology. The babies are still normal, and IVF babies have everything that every other baby has. So a child conceived via IVF is no different from a child conceived in the bedroom at night or in the afternoon. I remembered making a post about a misconception people had about people who have intercourse in the afternoon, that they will give birth to an albino. Please, that is not true. This just came in anyway. That is not true. So, like I said, IVF is just like any other pregnancy. IVF babies are just like any other set of children, and I want to let you know that I am rooting for you. I'm rooting for the fertile you. And if you are on this journey, about to start or you've been here before, please keep hope alive and know that all things work together. And at the end of the day, you have your testimony if you don't give up, right? And for our fathers to be, your wives need all the support they could get. If you have a family member going through IVF, it drains a lot of finance. It drains a lot of finance. Yes, it's even way cheaper here in Nigeria because in other countries you are talking from 40 something million and all of that. But here in Nigeria, you could get it within 3 million to 5 million, some places 2 million, depending on your treatment protocol. Some persons use their own eggs for the process, some persons use donor eggs, some persons use their own sperms for the process, some persons use donor sperms. There are some men that have a condition known as azoospermia, that they don't have sperms at all. So this kind of men, they would want to get donor sperms and all of that. Some persons use their womb, some persons use some other womb known as a surrogate mother. And then when the baby is born, they take the baby and compensate the surrogate. So I believe we've learned something at least in this webinar. Thank you once again for joining us, and I'll see you in subsequent webinars. Bye.